cute. However, we are also talking about some of the sometimes harsh realities. Dr. Mitchell, I know that you could hear that piece, and I'm wondering if you can just tell us, it seemed like such an idyllic setting. What about the injuries? What can happen?
Well, I think, first of all, Jennifer, I think the three people on the programme are agreeing. I know that Judy talked about padding down the hall, and I was careful to say that I really think intimacy between the mother and the baby is very important, and the crib should be next to the bed, not away from it. And I think Tamara was indicating they should be very close. Parents will make lots of decisions for their children, and professionals are not always going to agree with them. I think the key issue is that parents are aware of what they're doing and are given accurate information. And breastfeeding can be successfully accomplished without having the infant in bed. And people have actually studied this issue of breastfeeding and having the baby in bed and haven't shown that it's any particular advantage. So it is a risk. As I pointed out, it's a very small risk, and parents have to decide whether they're willing to take that small risk.
But
on the big question, should infants be close to their mothers? Of course they should be close to their mothers. They should be very close to their mothers.
But if you can get medical and clinical with us for just a moment, just as a doctor, is it just suffocation that is the potential risk with this kind of sleeping arrangement, or the broken bones? I mean, what's the worst that can happen?
Well, the worst that can happen is the baby dies. That's a terrible tragedy. I think the mechanism, how the baby dies, I don't think we really know. Sometimes it's suffocation. It may be more complicated than that. There may be other factors we don't know involved. But the fact is that it is something that seems to be associated with babies dying. And the number of babies dying of SIDS was falling. It's starting to rise in most Western countries where they track these things, related to the fashion of increasingly taking the baby into bed with the parents. And again, let me say that the baby and the mother, that intimate connection needs to be strengthened, but it needn't be in the bed.
Okay, well, we're going to take a quick break, but when we come back, we want to ask Judy Arnell from Attachment Parenting Canada what that group tells parents to alleviate the risks, and we also want to get back to our psychologist, Dr. Hanoski, find out some of the psychological drawbacks that this arrangement can have. Stay with us. More in the debate.
My children never slept with us when they were babies.
I don't really have a problem with it, to be honest. I mean, I think as long as the parents are just aware of where the baby is.
For me, it was a personal choice, but I thought it was also a safety choice. I'm all for it. My daughter sleeps with me. She has since she was 6 months old.
As a mother of 4 children, I'm totally against it. Some people think it's a bonding experience, but I think that everybody needs their own space, including children. So.
Some interesting thoughts from Albertans on parenting preferences, and we're continuing our debate on sleeping in the same bed with baby, bond builder or dangerous practice. Well, we want to ask our psychologist first up, what are some of the negative impacts of sleeping in the same bed with your baby in terms of psychologically?
Well, I think one of the things is from the baby's side, they don't learn how to self-soothe or get to sleep on their own. And I think a lot of parents just sort of fall into the co-sleeping out of exhaustion or out of convenience, and they just sort of don't even plan to do it. And then when they decide, well, I'd like my child to sleep in their own bed,
good luck.
They have a hard time, you know?
Because the mother in the story we saw before the break said, oh, it'll make the separate. He's more independent, not afraid to leave us. And I said, do you buy that? And he said, not really.
The stories that I've heard are that when they go to their own bed, the parent's then lying in their bed for a good hour until they fall asleep, so they aren't even using independent sleep.
And what about your marriage? Doesn't it hurt your intimacy with your spouse?
Well, yes, if you have the baby in the bed with you, there's not much time for couple time at all, let alone personal time. I mean, you're tending to your baby's needs throughout the day, and then to have that time at the end is often quite nice for some parents, whether it's with your partner or not, you know, to just have your own space. So
how about sleep quality? Can you always get that best, deepest sleep that as a parent you need?
I mean, it would depend on each individual, but for many people, I think they're so worried about the safety factors that they're constantly watching to make sure baby's face isn't covered, that they're not rolling on them, they're not falling, and so it's a very restless kind of sleep.
And psychologically, I think parents need to know too, I'm important, I need
Absolutely.
my rest, I need my space
and
time.
the couple is important, so they need their time, yes.
Okay.
Yeah.
Judy, you're with Attachment Parenting Canada. Can you tell us what advice you give people who really want to try this, the safe ways to prevent any kind of injury, and also just some of the things that Tamara possibly addressed?
Well, we encourage parents to both be on board. So the husband and the wife, or both partners, are happy with the arrangement. They're going to find ways to be intimate as a couple, for sure. We also, no 12-year-old is going to be sleeping in your bed, so kids are different. Each one will learn to self-soothe and grow independent at their own rate. Some safety factors. SIDS can happen anywhere, anytime. So the main one you need to watch for is suffocation. We say you need to avoid overheating, not have baby between mom and dad, because in many cultures, usually mom sleeps with baby. That means there's no siblings, no family dog in the bed with you. If mom's on prescription drugs, any alcohol, anything like that, don't sleep with baby. If mom's overweight or has smoked during the pregnancy, don't sleep with baby. We have a whole list of risk factors on our website if anyone's interested in more information on that.
And can you each tell us, we'll start with you, Judy, and work our way around through Ian and Tamara. How common is bed sharing, sleeping with baby, especially here in Alberta? Is it something more people are doing than admitting? Do you have any idea how many people are doing it?
I would say in teaching parenting classes, almost every parent has taken their baby into their bed at some point in time in that first year, whether it's the beginning of the night or through the night, nap time, or early morning getting them back to sleep, or if baby or mom is sick, they come into bed. And if they don't know the risk factors, they don't know how to make it a safer sleeping experience.
Tamara, you had told me 30 to 40%. You're thinking through what you've seen in practice.
Guess.
What about when the baby isn't a baby anymore? They're 6, 12, or 17. Is it good or bad?
17, definitely not. As they get older, I mean, I think everybody needs their private space and their own time and privacy. And I think that as kids are getting older, they need to be developing their independence and separating from the parent. So if they're still sleeping in your bed at that age, I worry about that, about the level of dependence on the parent and whether they are sort of growing up into an independent little person.
Okay. Yeah. Well, Dr. Mitchell, let's give you just the very final word here. You say, what, do it but carefully, or?
Well, first of all, my views are coloured by the fact that I meet parents whose child had died of SIDS, which is a tragedy, and I think Judy has listed a number of things which increase the risk. Babies are safest sleeping in a crib on their back close to the parent, and the further we move from that ideal, the more risky it becomes. It's not that SIDS can happen anywhere, anytime. It is almost unknown to happen in a crib when the baby's on the back. Then the further we move away, smoking parents who are very tired, all the other things. I think parents will do all sorts of things when they look after their child. I think they should have the information to make the decision for the child and should understand a little bit about the risks.
Thank you so much for your professional opinion, and also for all of our guests for their insight. Great to have you here, and hopefully our viewers have learned a little something too. Now here's Jefferson with tonight's open mic.